Welcome everyone. This is the poster session for today. The subject for today is environmental science and public health. And thank you everyone for joining. We have 4 presenters today, actually 5. And we have the Q&A chat box down below. If you have any questions, you can go ahead and enter them there. And all questions will be answered at the end of the presentations. And then just a quick reminder that all the posters will be on the UCGIS website as well. So you can go ahead and view them on there. And we'll have a link on the chat box for that as well. So if everyone's ready, we could start. First up, we have Nicole and Jared from UCLA. And poster is Spatial Equity Mapping, Patterns and Distributions of Neighborhood Risk. So if you would like to start.
Cool. So thanks everyone for joining our poster session. So my name is Nicole and I'm joined by my colleague Jared today, and we're going to talk a little bit about spatial equity by mapping patterns and distributions of neighborhood risk. And so a lot of this work really focuses on the social and physical factors that are impacting health outcomes for children. And through much of our work, we've learned that unfortunately, there are differences in exposure to such factors, and they can vary by race and ethnicity, both between and within neighborhoods. And this really signifies sort of the importance of place and having population-based measures as critical pieces towards the goals of achieving health equity. So as far as methods and approach goes, we use the Neighborhood Risk Index, which is a composite measure of 10 indicators that are pulled from the American Community Survey. And this is at the census tract level, which is how we define neighborhoods. So we measure how prevalent these risk factors are for a neighborhood for children by generating the one-dimensional maps you see in the middle of our poster. So a neighborhood would be considered at risk for a potential indicator if they are plus or minus 1 standard deviation from the national mean of that indicator. And the total number of prevalent risk factors is summed for each census tract and classified into 4 groups, which if you could see, it's the 0, low, medium, and high. And so those are our risk levels. And the 2 little charts below show you the positive and negative indicators that are included in our index. And so we're engaged in this work with a number of cities in the California region. And Eric will talk a little bit more about some of the patterns that we observed in the city of Long Beach and why we chose this as our pattern to display. Jared?
And now I'm unmuted. All right. Thanks, Nicole. So the back.
I'm not sure. Oh yeah, I can hear you. Sorry.
Can you see me?
We can hear you.
I can't.
Yeah.
All right. All right. Thanks, Nicole. So the background to all of this is that our center has been engaged in promoting child and family well-being among political leaders throughout LA County. And we've been working with them and connecting them with one another in order to advance issues of children's health and well-being. Sorry, is there? Sorry. Looking at the raised hand. So we're working with them to connecting them with one another to advance those issues in their communities. And so one of the ways we're doing this is discussing their data from their communities with them related to child development. So although we've created maps and analysis for 10 different cities, we chose to focus today on Long Beach for a couple of reasons. First, as you can see, their map clearly shows some clusters of high risk around the Port of Long Beach and in the northwestern portion of the city surrounded by areas of relatively low risk. And so the distinguishableness of the pattern makes the map potentially much more valuable to the local leaders who want to use it to target place-based interventions, and makes it easier for them to create an accurate narrative about what's going on in their cities. Second reason why we're focusing on Long Beach is that it's a good example about how on a large scale the built environment can impact neighborhood risk. For instance, the area around the port the risk is much higher in that area, and the 405 seems to serve as a geographic barrier between neighborhoods of low and high risk. And finally, Long Beach has a large and diverse enough population that there would be sufficient numbers of people from each of the racial categories to allow for a useful analysis. And that's something Nicole can tell you a bit more about.
Yeah, so looking at the bar graphs right below the map, the distribution of neighborhood risk by race. So here we're essentially comparing Los Angeles County to the city of Long Beach. And two things are worth noting from these bar graphs is that in Long Beach City, the children are growing up in neighborhoods where medium to high risk levels make up at minimum 40% of the risk distribution. And this is true for nearly all racial groups except for white in Long Beach compared to LA County as a whole. However, the proportion of medium to high risk, so those are the darker colored purple portions of the bars, is slightly higher in Long Beach than it is in Los Angeles County. And this is actually true for every single racial group that we pull the data for. Finally, just looking within Los Angeles County, so that's only the bar graphs, I believe, on the right, the 0 to high risk level, so those are the lighter colored purple portions of the risk distribution are pretty small, like they make up a relatively smaller proportion of the risk distribution compared to the medium and high risk levels for all racial and ethnic groups in LA County, except for white and Asian groups, where you see a slightly larger portion of low to 0 risk levels. And so these findings have pretty significant and important implications for the work that we're doing. And I'm going to pass it back to Jared just to talk us through that and some of the future directions.
Yeah, so we covered a bit of this while we were discussing the map, but when the goal is to inform policymakers about a topic, it's very, very important to communicate information in a way that's accessible to people who don't necessarily have a lot of experience working with data, not just because the lawmakers themselves might not be comfortable with interpreting data. Actually, a surprising number have been, but that they're going to be taking this the information and the maps that we give them, if they're going to be using it to make any sort of change happen, that information has to be potentially understandable by all of the people that they're going to share it with, including their colleagues, their constituents, and the media. So showing that the developmental risk factors are linked to geography and race can help make the complex but really important discussion of structural barriers and inhibiting people's development a little bit easier. And so when you combine the information from the maps with the on-the-ground information from local leaders and community residents, the maps can be used to create narratives that help explain a community's problems and as well as the factors that may have led to them. The maps can also help decision makers identify the areas of opportunity by revealing the neighborhoods that could benefit most from policy changes or other interventions, and giving these decision makers the option to implement place-based strategies that can complement citywide policies or the programs that are targeted at the level of the individual. Going forward, our hope is to use these maps to help cities think about themselves more from a spatial perspective and to help them explore the histories underpinning the data. From there, we would like to work with these cities to identify strategies that can effectively target their patterns of neighborhood risk and eventually create a network or a platform that allows these strategies to be shared between an expanding group of cities.
And we'd just like to thank our colleagues, Efren Aguilar, Charlene Choi, and Joshua Bader, who are also part of our team. A few of them might be logged on, but they've also been a critical part of the work that we've been of this project. Yeah, thank you.
Great, thank you so much to Nicole and Jared for that presentation. Next, we have Huda Abdelmajid from Stanford, and The presentation for this is Spatial Disparities and the Burden of COVID-19 by Social Determinants of Health Among Veterans in Veterans Administration. And you can go ahead and start sharing your screen.
Yeah, sure. Just give me 1 second. Get organized here. Okay, can you see my slides?
Yes, we can.
And not my notes, right?
No, you're good.
Okay, sounds good. So hi everyone, my name is Hoda Abdul-Majid. I'm really excited to present our group's work on COVID-19 tests and testing positivity in the VA. This is a collaborative project with many people and consists of many different parts. So this specific presentation covers spatial disparities and testing specifically, and not test positivity, just in the interest of time. And all the views expressed in this presentation are those of myself and my co-authors, and not of the US VA. This work is funded by the BD STEP program, which I am a second-year fellow in, and is a really wonderful training program across VA sites and in collaboration with universities across the country. I'm happy to answer any questions about it. So in early March this year, the pandemic began to impact all of our lives. It quickly became apparent that we needed to understand how COVID-19 was impacting different populations and social groups. However, data was incredibly limited outside of the veteran population. As part of the BD STEP Fellowship, myself and colleagues volunteered to lead analyses evaluating the potential health disparities among veterans, leveraging the really rich electronic health records of the VA. As the months progressed over the course of the pandemic, it has become clear that COVID-19 continues to affect socially marginalized groups. These vulnerable groups are disproportionately affected by the current pandemic, both in terms of increased risk of infection and from the myriad adverse medical and societal consequences of the virus. This is due to a confluence of factors, including a high proportion of essential workers, crowded living conditions, poor access to healthcare, and a disproportionate burden of underlying conditions such as diabetes and heart disease that increase the risk of death from COVID-19. We are particularly concerned about health disparities in veterans served by VA, as veterans in care at VA on average have more comorbidities, a greater risk of homelessness, and disproportionately live in rural communities. Equitable access to high quality healthcare for all veterans is a cornerstone of VA's healthcare mission. So implementing policy to correct health disparities within VA's system is of tantamount importance. We merged individual veterans' health characteristics from the electronic health record with county level characteristics. And these are the county level data that we focused on. They include measures of poverty, education, health insurance, crowded housing, broadband access, household income, income inequality, historic unemployment rates, and county composition of non-native and non-white residents. And you can see here that they come from a myriad of different sources, including the census, the CDC, and the area health resource files. We followed 6 million veterans for VA administered COVID-19 tests from February 8th, which was the earliest recorded COVID test in the VA, through June 23rd. So this was for the first component of the analysis, but you'll notice the poster says through August 27th, and that is because it is an updated analysis. So third-party tests, for example, any test that was ordered by a public health department was not included in this analysis. Test results were recorded as negative, positive, or inconclusive, and we dropped inconclusive tests from our analysis. This impacted only about 148 patients, as most inconclusive tests had a second successful test performed after. So among individuals with multiple tests, approximately 43,000, we used the first negative test if they never had a positive test, and their first positive test otherwise. geographical region was determined by VA service districts. Our study showed regional differences in testing and test positivity among veterans in active care at the VA. In particular, there was a higher proportion of veterans who tested positive for COVID-19 in the Northeast District, which includes states like New York and Massachusetts that were impacted by COVID-19 heavily at the onset of the pandemic. Of note, there was a lower proportion of veterans testing positive for COVID-19 in the Pacific District, which of course includes our state, California. So this specific portion of our project focused on heterogeneity of COVID-19 testing rates, spatial heterogeneity of COVID-19 testing rates specifically. So I'm going to skip over a few slides just in the interest of time, but our research question was, are there potential spatial disparities in COVID-19 testing among veterans enrolled in the VA? And then in this portion of the analysis, we extended follow-up time to follow veterans through August 27th, 2020. Age-specific rates for COVID-19 should be routinely available by race, ethnicity, as well as by gender. While age may not play as critical a role in confounding the estimates of testing rates as it does mortality, it is still a really important idea to adjust for age, as age is a strong predictor of care. So our objective was to calculate age-adjusted rates of COVID-19 testing by county to examine spatial heterogeneity. And to examine if age-adjusted testing rates varied by place, we calculated the age-adjusted testing rates for each county in the contiguous US. And age-adjusted testing rates were standardized to the nationwide population of veterans in active care at the VA. And ultimately, this enables us to compare rates across counties while accounting for the different underlying age structure of each county's population. And rates are presented per 1,000, which accounts for differences in population sizes. I'll stop here just in the interest of time. But here we present the age-adjusted cumulative COVID-19 testing rates by county. We have only calculated the age-adjusted testing rates among counties with more than 100 veterans to produce stable estimates. Counties in white either did not conduct any testing or they had fewer than 100 veterans in active care at the VA, living in them at the time of our analysis. So we see hotspots on this map consistent with crude estimates from the CDC. Many hotspots correspond to urban areas. Some hotspots on this map include the Bronx with an age-adjusted rate of 336 per 1,000 veterans, and San Francisco with 205 tests per 1,000 veterans living in that county. Other major centers with highest cumulative tests include New York, DC, Richmond, Virginia, New Orleans, Louisiana, Columbia, Florida, which includes Lake City and Gainesville, Florida. Testing is nearly non-existent in some rural states, such as Wyoming, but there are hotspot areas corresponding to the capital, Cheyenne. And so with that, I just would like to conclude that we were able to demonstrate significant spatial heterogeneity in testing rates among veterans in active care at the VA. And this really supports the need to optimize care strategies that identify at-risk populations and require greater resources and support. This project was supported by many collaborators and many organizations within the VA. And if you have any questions, I or my fellow first co-author are happy to answer any questions. Thank you so much.
Thank you, Huda. I know that you're going to leave early, so if there is any questions, you can go ahead and join this Slack later, and I can post them on there for you.
Sure, yeah.
Up next, we have Alyssa Hemler from UCLA, and this presentation is on MetaMap, so we can start sharing your screen.
Hello, thank you so much for having me today. I will quickly talk about MetaMap. I don't know what's going on. One moment. Un moment. Can you see this?
Yes, we can.
Perfect. So I will be talking about MetaMap, mapping with accessibility in mind, which is super, super important to our group. Quickly, here's an introduction. My name is Alyssa Hemler. I'm the project director of UCLA's Undergraduate Student Association Council's Facilities Commission's Access on Board, which specializes in helping students with disabilities and fighting for their rights. I am also on the Disabled Student Union's PR team and on the UCLA Committee on Disability as an undergraduate student representative. So we wanted to reimagine accessibility on UCLA's campus map. And what it is basically it's a static map, and we hope to put universal accessibility in mind and create an interactive map so that we can have a bunch of accessibility features on the map so that anyone visiting UCLA or a student or a family member or anyone really could see the best, most accessible ways to get around, as well as have directions to those places and accessible features on campus, such as accessible bathrooms. Why MetaMap? Because we want to normalize and prioritize accessibility to reach equity on UCLA's campus, but also within the UC system and in the greater context of higher education in the world and in America. So we wanted to emphasize and highlight the disabled student experience. It is super important to us, as a good amount of students working on this project are students with disabilities, including myself. We want to put their experiences at the forefront of this project and make them feel included on UCLA's campus and in general. This is part of a greater UC-wide advocacy towards disability visibility at the UCs. So specifically UC Access and the UC Ad hoc on disability. Progress and potential. So our first phase was accessible bathrooms and other assets, which are powered entrances, blue lights, elevators, which we hope to add to the map fairly shortly. Please note this phase of the project has been put on hold because we are in COVID times and we are not allowed to physically map on campus. So this part of the project has been on hold, but we have been able to virtually map accessible routes. So this is the point of the project where you will be able to get navigation of accessible routes. It's super exciting. We're excited about it. Then we will put it on the UCLA 311 app so that you can access the navigation. It's super great. Thank you to UCLA Facilities Management for partnering with us on this part of the project and the whole project. It is an all-inclusive, accessible, interactive map with various features to make UCLA a more equitable space for students and staff and faculty and friends of UCLA with disabilities. We are super excited for it. Thank you for allowing me to talk about it.
Thank you, Alyssa. Up next, we have our final presentation, and that is by Andrew Meir from UC Riverside. And it's GIS-based geologic mapping and analyst of the Kaipo, Mélange, New Zealand. So if you can go ahead and start.
Yeah, thank you. Thanks everyone for showing up and having me. And so my name is Andre. In a nutshell, I am a geologist. I'm a grad student at UC Riverside, and this project is related to sort of GIS application as it relates to remote digital mapping, geologic mapping that is carried out after subsequent field investigation, and a little bit of an exploration of some of the ways that we can use LiDAR data in order to understand more about geologic processes that are happening around us and are of importance to people living all throughout New Zealand and really in Southern California as well. And so as an introduction, throughout New Zealand, running down the South Island is the Australian Pacific plate boundary. And so this is a plate boundary continental fault, and it can be thought of as analogous to the San Andreas fault system. And it poses the single largest onshore seismic hazard in the South Island. And as a good rule of thumb, a good way to think about a recurrence interval for an earthquake happening on any given fault is to think about the rate that that fault moves at. And you divide the average co-seismic displacement by that rate. So if you have a fault that on average moves 9 meters per earthquake and slips at 30 millimeters a year, then every 300 years you can expect to have an earthquake on that fault. And furthermore, the longer that the fault ruptures, the greater the earthquake will be. And so in the case of New Zealand, we see a very periodic and regular recurrence interval on the Alpine fault of around 300 years. And it's capable of rupturing in at least magnitude 8 earthquake, which can produce devastating effects on landscapes. It can level buildings, and of course it can cause loss of life. And so what we utilized is proprietary LiDAR data, which is able to penetrate the dense rainforest canopy in order to have high resolution digital elevation models and digital terrain models that allow us to map active surface fault traces. And so that's what this middle figure is a preliminary geologic map of the Kaipo slips area, where essentially you have large landslides that are exposing bedrock that we were able to map in person. And then using LiDAR data and what's called a multi-hill shade, I was able to map additional active fault traces and sort of connect the dots between observation points. And so what these multi-hill shades look like, you can see one here. And what essentially is happening is you have illumination from 3 different angles in 3 different color bands. And so that gives you essentially a very, very high resolution sort of flow raster, which shows the direction that a slope is facing. And you're able to overlay that onto your high resolution digital elevation model in order to visualize the terrain remotely and with more accuracy and more precision than you would be able to in person, again, because this is an area covered by incredibly dense rainforest. And so another thing that I wanted to do with this project was to try to better constrain slip rates on the Alpine fault, because as I mentioned, the slip rate directly corresponds to the periodicity of earthquakes. And so what I did was looking at what we called offset geomorphic markers, which are landforms that were initially continuous across the fault trace that have subsequently been offset over time. And by knowing the age of those markers and by knowing how far they're offset, you can calculate an offset rate. So I have an example here of what are lateral moraines, which are features left on this hill slope from a previous glaciation. And what I did was identify these surfaces, and you can see with these dotted lines, these are the surfaces that were identified. And I extracted the elevation data from that raster and actually created a linear interpolation, or a linear trend interpolation rather, that uses a second order polynomial to interpolate basically these missing areas that are things like landslides or river valleys. And then I processed that to be left with equal elevation contours that could be measured in a fault parallel direction in order to gain measurements of offset on fault. And so these are a couple representative areas, one on either side of a glacial valley that I used. And then finally was able to do just some very light statistical analysis on them and correlate them to our best guess for the age of glacial recession, which is when these surfaces were last intact, and ended up finding about 500 meters of offset on average for these features. And so taking an age of about 18,000 years, I ended up finding that the slip rate on the Southern Alpine Fault in our study area is 27.7 plus or minus about 2.6 to 2.8 millimeters a year, which is 14% faster than was previously recognized using very similar or the same offset geomorphic markers. And I was also able to document significant active faulting in the region that is essentially offsetting and juxtaposing basement rock units that previously was unrecognized, which also has implications to the sort of material properties of the fault zone. So essentially my conclusions are that high resolution topographic data in the form of LiDAR is able to sort of see through the canopy and do a better job. We're able to do a better job remotely with this data than we could do in person in order to identify features and to measure offsets on features. And furthermore, that trend interpolation provides a very powerful tool for GIS analysts or geomorphologists or geologists to have a best guess on pre-erosional or pre-offset landforms. And so in future work, what I would like to do is actually have direct age control on some of these measured offsets. So there's a handful more that we've identified or I've identified that are not in this presentation that I would like to be able to actually sample and date in person, and then also expand upon this to more spatial, more regions along the fault trace in order to see the spatial distribution of slip rates and understand the seismic hazard more thoroughly. And so that's my talk.
Thank you so much, Andre. Yeah, at this point, if anybody has any questions, please go ahead and enter them on the Q&A. Let's see if I see any. And like I said earlier, all the posters will be available on the website. We put the link up on the chat box as well, so you can be able to see them closer up, or the ones that did the PowerPoint presentations. You could see the actual posters. Yeah, all the presenters, if you can turn on your cameras, and thank you. Thank you guys. It was a really good talk from everyone, and trying to see if there's any questions on the chat. Albert, did you have any questions? I know you.
Hello. Sure. One question I have is, what do you see the intersect between kind of the public health work that Jared's doing and kind of the disability mapping that Alyssa's working on, as well as kind of, we touched on quite a broad topics with the like physical geography too. And so I'm just trying to see if there is just what the thoughts are on just everyone here, and if there's room for collaboration and that type of feeling.
Personally, I feel like disabilities intersects really well with public health, as the geography of a specific place is really impactful on a person's health. So I am chronically ill, and it is very tiring for me to walk around UCLA, which is a very hilly, very steep place to walk around with lots of stairs. It is super beneficial if I can use a few elevators instead of walking all those stairs. And that helps me not break down by the end of the day. Whereas if I'm walking up all these hills and I'm taking a few hours to get to class instead of 30 minutes like my able-bodied peers, then it benefits my health in the long run to like not have that wear and tear on my body every single day.
Yeah, and I would just follow that up. I agree that there's definitely a lot of opportunity for cross-fertilization. I think, the way that our presentation, the way we looked at in that research was at a higher level, but the next phase of that, if you're looking at things spatially, is to get down to the ground level and actually spot where issues are, and not just find problem areas, but find solutions. It's so census tract level data. But I think that would be definitely the next. Doing that is not a bad idea as a tool. Bringing the idea of kind of geospatial community development and health down to a more understandable level for people. So doing that with the cities is actually not a bad thing to pursue.
Thank you for that. We have one question coming up for Andre. How much of GIS experience did you need to map the data shown on your slides?
Yeah, so that's a good question. In terms of GIS experience when it comes to actual geologic mapping, I think it's relatively intuitive for anybody who has experience with things like Photoshop or Illustrator. And I personally had about a year of GIS experience beforehand. So that's not too bad. When it comes to actually processing elevation data and topographic data and making sense of it, unfortunately, that does require quite a bit more experience and knowledge of all of the different tools that are built into ArcGIS Pro in particular. And so I think that is what really has the steeper learning curve to know exactly what you're doing. But fortunately, I think documentation on is pretty easy to find on the internet, and generally you're able to kind of guide yourself for the most part.
Cool, thank you. We have one more question. I think it's for everyone. In terms of access to mapping technology, can you talk about your personal experience in learning GIS mapping? What advice would you give to newbies?
So for me personally, as a UCLA student, I got involved because I'm in student government and they were currently working on MetaMap and they were like, hey, would you like to join? And I was like, absolutely, I would love to. And I really got to learn about GIS and got GIS experience through UCLA's IDRI and facilities management, their project on MetaMap, as well as USAC-BAC DCP, which is Disabilities Computing and Technology Programming. I might have butchered that a little, but they're amazing and they were doing such great work and they really taught me how to use GIS and ArcGIS and OpenStreetMaps. So if you are a UC student, please check out your local GIS programs. They are excellent and it's free for you guys. So highly recommend.
Cool, thank you. Does anybody else have any advice for newbies?
I think just to add on to what Alyssa said, my impression as somebody who's a bit newer to using GIS for just over a year and a half or so, is that there's a lot of different avenues and there's a lot of different ways that you can use GIS. And I think that is kind of one of the most confounding things initially. But once you do narrow down what you want to get out of it, I think that's kind of your first step to learning. So yeah, a little bit of self-reflection and internalization of what are your goals, and going from there are going to serve you.
Thank you. We have a question for Jared and Nicole. You were able to map the colored areas based on your surveys. Also, did you collaborate with other organizations in the area?
So the data that we pulled that we used to map came straight from the Census Bureau, the American Community Survey data, and we merged that using the GeoID with demographic data from the Census Bureau to get the racial and ethnic data that we used for some of the bar graphs. So we did not collaborate with other organizations in the area to do this specific piece, unless Jared, I'm missing something with that. So this was kind of done in-house at the UCLA Center for Healthier Children, Families, and Communities.
Yeah, we didn't, in using the maps, we're collaborating with local governments and other groups, but in generating it, no, this was in-house.
Yeah.
Thank you. I think I missed a question earlier from Efren. So he's asking, I'm wondering what the plans are for cross-fertilization and shared learning across the crop of new mappers. I'm not sure who that one's for. I believe it's for all. I'm wondering about what the plans are for cross-fertilization and shared learning across the crop of new mappers. So yeah, it's for all.
So on our specific project, we are actually going to open it up to public volunteers for help on mapping and getting accessible routes. We'll be holding a MetaMapathon. And I think that's a really great way for any student to get some mapping experience, even if they don't have any currently and they want to get involved. But check out your school's GIS programs to see if there's anything they're working on that you'd like to get involved in. I highly recommend.
Thank you. And then just a comment from Andre, QGIS may be an alternative to ArcGIS for those without access to Esri. And yeah. Does anybody else have any more questions or comments? Okay. So I thank you guys all so much for participating in this event. We'll have all the information on the website for all the posters. And yeah, have a good rest of your day, everyone.
Thank you.
Thank you.
Thank you so much.
Thank you again.
Thank you.